Non-pregnant women of reproductive age typically have menstrual cycles that last approximately 1 month. Every month, an ovarian follicle containing an ovum, an egg, grows under the influence of the body's hormones. At the midpoint of the cycle, ovulation occurs, which is also regulated by hormones. The ovum, which is ready to be fertilized from this point on, is taken up by the fimbria of the fallopian tubes, which act as conduits to the uterus, where it awaits the arrival of viable sperm. The desire to have children is a natural human instinct, but it cannot always be fulfilled. The causes of unwanted childlessness are numerous, as are the options for treating them. With intrauterine insemination, the timing of sperm delivery is tightly controlled using a sperm sample provided by the male partner at the time of ovulation, or by using a previously frozen sample. In the laboratory, the ejaculate is often passed through a special filter system in a conical tube, slowly centrifuged and then washed. Only active sperm cells are collected in this way. Other parts of the ejaculate are discarded. Using a syringe and a thin catheter, the prepared sperm cells are directly introduced into the cavity of the uterus or womb beyond the cervix, the mouth of the womb. Once deposited there, the sperm immediately make their own way towards the awaiting egg in the fallopian tube. The objective here is to minimize the distance to the egg awaiting fertilization for as many fit sperm cells as possible. As a result of the earlier preparation, the sperm cells are more motile and the heads of the spermatozoa have undergone a maturational process that prepares them for fertilization. With in vitro fertilization, which is sometimes known as the test tube baby technique, the ovaries are first stimulated with hormones so that they produce several ovarian follicles. Before physical ovulation takes place, but after oocyte maturation is initiated by the administration of a further hormone, the follicles are aspirated. This means that the follicular liquid and the egg it contains are extracted with a needle. This is performed under sedation in a short outpatient procedure, with the doctor using transvaginal ultrasound to check the proceedings. In the lab, the eggs collected in this way are brought into contact with sperm cells which have already been cleaned and concentrated. The eggs and sperm cells remain in an incubator set at 37 degrees centigrade for 24 hours so that natural fertilization can take place. During this process, one of the many sperm cells will find its way into each egg. Once fertilization has happened, at least one living embryo that has already divided itself into 4 to 8 cells should have developed. 1 to a few days later, one or more embryos are transferred by means of a thin inflexible catheter to the cavity of the uterus, where the embryo can embed quite naturally into the uterine mucosate lining of the womb. A further development of in vitro fertilization is what is known as intracytoplasmic sperm injection, or ICSI for short. The ovaries are first stimulated with hormones to allow several ovarian follicles to mature. The eggs are then removed by aspiration. This takes place under sedation during a short outpatient procedure. Fertilization takes place by injecting an individual sperm cell into one or more of the collected eggs. For this purpose, the egg is held in a holding pipette and one sperm cell is injected under the microscope directly into the ovum by means of a very fine pipette. After about 24 hours, the eggs are checked for signs of fertilization. After a further 24 hours, the embryo, undergoing cell division all the while, can be transferred to the cavity of the uterus by means of a thin catheter and left to embed itself into the uterine mucosa, just as in natural pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A physician consultation and thorough examination are prerequisites for establishing the most appropriate treatment with the highest chance of success for each individual patient. Because female fertility decreases after the age of 35, couples with an unfulfilled wish to have children should not delay seeking appropriate medical advice.